Dear committee, dear audience, it's a pleasure to present the progress of my PhD work, the title of which is Investigating the Efficiency of Arterial and Venous Endovascular Procedures. My name is Dávid Laczkó. I'm a medical doctor and a PhD student at the Department of Interventional Radiology at Semmelweis University. My vision is to eliminate the consequences of arterial peripheral artery diseases by making endovascular procedures more available and widespread. In order to achieve my vision, my mission is to provide clinicians with up-to-date knowledge about the most suitable procedures. In order to achieve my mission, we have two specific goals. The title of my first project is Investigating the Effectiveness and Safety of Bronchial Artery Embolization. And as a background, severe and recurrent hemoptysis has a high mortality rate of about 70 to 80%, and it is a life-threatening emergency. 90% of these cases are caused by the bronchial circulation due to the inflammation of the lung or due to lung cancer. Possible treatments include conservative treatment, which has proven to be ineffective. Surgical treatment is also a possibility. It is effective, but it has a high mortality. As a reason, the first line of treatment is the endovascular treatment. There are three possible types of embolic agents that can be used. First, there are particle agents, including embospheres, microspheres, and PVA, polyvinyl alcohol. Second group is the liquid agent, which is cyanoacrylate. And third, coils can be used, but they are rarely used alone. Our clinical question is, are different embolic agents effective and safe in bronchial artery embolization for hemoptysis? Our population consists of patients with hemoptysis. We have two exposure groups. One exposure group is patients treated with particle embolic agents, including microsphere and polyvinyl alcohol, and another exposure group, patients treated with liquid embolic agent. Our primary outcome is 1 year hemoptysis-free survival, and our secondary outcomes include technical and clinical success, perioperative and 1 year mortality and complication rates. Our hypothesis is that particle and liquid embolic agents are effective and safe in the treatment of hemoptysis, and the clinical implication could be to make bronchial artery embolization more widespread by proving the effectiveness and safety of the different embolic agents. We conducted a systematic search on the 2nd of November in 5 different databases. You can see the number of results, and you can also see our search key. The first domain refers to the procedure, and the second domain refers to the condition that is treated. Here you can see 2 of my key articles. The sense of these articles is that all of our outcomes were measured, and both of them has a large population, and the limitations include that both of them were retrospective observational studies performed in single centers. Here you can see the flowchart of our selection. We found more than 5,500 articles, and after duplicate removal, 2,500 articles remained. Right now, we are at the step of title and abstract selection, and while my co-investigator is still doing the title and abstract selection, I've made a preliminary full text section, and as you could see, we will have around 50 plus articles that could be included in our study. The title of my second project is Comparing the Effectiveness and Safety of Surgical and Endovascular Treatment of Symptomatic Carotid Stenosis. It will be a cohort analysis of around 800 cases. As for background, stroke is the second most common cardiovascular disease, annually causing over 1 billion deaths in Europe alone. Now, 20% of strokes are caused by the stenosis of the internal carotid artery. Possible treatments include base medical therapy, either combined with surgical treatment. Surgical treatment means that the internal incision is made on the internal carotid artery and the plaque is removed, and the blood flow is restored to the brain. Or another possible treatment is endovascular procedure, which means the insertion of a catheter, the dilation of the artery, and the insertion of a stent. During the endovascular treatment, an embolic protection device can be used to prevent the further embolization of the brain during the manipulation of the stenosis. The most recent guidelines don't give a recommendation whether to use these devices or not, And there's a debate right now because there haven't been any randomized trials about the usage of these devices. Our clinical question is carotid stenting with an embolic filter as effective and safe as carotid endarterectomy in the treatment of symptomatic carotid stenosis? The population consists of patients with symptomatic carotid stenosis. The intervention group is carotid stenting with embolic filter. The control group is carotid endarterectomy. And our primary outcome is perioperative and 30-day stroke rate. Secondary outcomes include perioperative and 30-day mortality and complication rates. Our hypothesis is that carotid stenting with embolic filter is as effective and safe as carotid endarterectomy. And the clinical implication is that we would like to make carotid stenting more widespread by proving the effectiveness of the embolic filters. So to summarize everything, we have 2 projects ongoing at the moment. The planned submission date of our first project is May 2024, and the planned submission of our second project is September 2024. I would like to end my presentation with one of my favorite quotes by W.C. Fields: "If at first you don't succeed, try, try, try again." Thank you for your attention.
Hello, my name is András. Thanks for the nice presentation. You would like to make more widespread the bronchial arterial embolisation in case of hemoptysis. What are the most common side effects of the intervention? Why should I afraid of the intervention?
So mostly there are non-serious side effects, including headache, nausea, vomiting, chest pain. But if somehow these bronchial arteries arise from the spinal arteries, embolizing these arteries can cause the infarction of the spinal cord, which is a very serious complication.
Hello, David. Thank you for the nice presentation. I'm wondering if you use embolic protection devices in your center for every carotid stenting procedure?
Yes, every procedure is done with the usage of embolic filter, and this will be one of our strengths of our studies. That I think it's the first study that has patients only with the usage of embolic filters.
Thank you.
Congratulations on your presentation, David. Okay, so my question is about your first project. You mentioned that you want to report as a secondary outcome technical and clinical success rates, and how would you measure them, and what are they mean?
Thank you for the question. So, the success rate of the clinical success means that the hemoptysis stops in 24 hours. And the technical success means that when we embolize the arteries and there's a control angiography, we can see that all of the abnormal arteries were embolized.
Thank you.
Thank you.
Congratulations. And I want to ask you what you experience in your clinical practice, which is more common, hemoptysis due to the lung cancer or due to the inflammation?
Thank you for the question. In Hungary, lung cancer is the most common cause of hemoptysis, and is the case in Europe as well. And in children, the most common cause is cystic fibrosis.
Thank you.
I have one question regarding your second project. I saw that you were planning to study different interventional methods for treatment of large vessel occlusion strokes. So I was just interested whether you plan to do I think you're aware of the treatment, recent treatment, the bridging therapy, IVT, like intravenous thrombolysis before interventional endovascular treatment for strokes. So I was wondering whether you plan to do in the future a research on that bridging therapy, IVT first and then endovascular treatment for this kind of strokes.
Yes, that's a very good question. In our center, only the stenting is done. The thrombolysis is done by neurointerventionists, and they don't do that procedure at Városmajor.
You said that you were planning to analyze the data on more than 800 patients,
Yes.
okay? And you will compare the endovascular procedure to the surgical.
Yes.
Do you know what is the proportion between the, so what is the sample size
yes.
for both groups?
I think around 600 surgical procedures were done and 200 endovascular procedures were
Yeah,
done.
and are you planning to do a propensity matched subgroup analysis?
Yes.
Because there might be a different indication for both.
Yes, we plan on doing that later. Yes.
Yeah. But you're obviously already biased. Because you said that in your clinical implication that you want to make the whole world to use your technique. Is that correct?
Well, no, I don't have any bias.
Yeah,
No, there's no way.
come on. Okay, good.
Yes, thank you.
Stop crucifying.
If I may have one last question. You mentioned that the bronchial circulation is the main reason in 90% of the cases of bleeding. What is the other 10%?
The pulmonary circulation, and there might be some systematic connections with the pulmonary circulation. Those are the remaining 10%.
But the treatment is mainly the bronchial.
Yes.
Bronchial embolization.
Yes.
So you cannot treat the rest, practically.
Those can be treated as well, but then not the bronchial artery is embolized, but the pulmonary artery.
Okay, fantastic.